2 seconds to spare.
Right on time.
All right. We'll start with the Pledge of Allegiance. I
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Welcome to the August 12th, 2021 meeting for the Shawnee County Board of County Commissioners. My name is Kevin Cook. I serve as the chair this year, also representing District 2. Joining me today is Commissioner Aaron Mays, representing District 3. Good morning.
Morning.
Commissioner Rippon is not able to join us this morning. Madam Clerk, our first item.
Item 3, consent agenda.
There are quite a few items on the consent agenda. Are there any questions or motion to approve?
I will move to approve.
Motion to approve by Commissioner Mays, second by Commissioner Cook. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item 4, new business. County Clerk number 1, consider all voucher payments.
This morning we have vouchers totaling $1,768,053.31. We got 3 highlights under that. Under Family Park, Lake Shawnee and Asset Management to Santander Leasing totaling $135,599.53 is for our mower lease. Under Sheriff to Tyler Technologies for $16,461.46 is for the annual support maintenance of the Civil Serve and Civil Mobile. And then under Solid Waste Recycling to Terracon for $23,410 is for the closed landfill corrective action plan. And then $4,150 for the closed landfill annual services. And I believe that's the old landfill. So I don't have any questions. I would move for approval.
I'll second. Motion for approval by Commissioner Mays, second by Commissioner Cook. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item 2, consider correction orders.
I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Mays. All in favor say aye. All opposed? Reflect that it passes 3-0. Our next item.
Item B, facility management number 1, consider authorization and execution of contract C277-2021 with McElroy's Inc. for repairs to the courthouse dual duct VAV boxes at a cost of $44,100 utilizing contingency funds.
And Madam Clerk, before we begin, I was reminded by our helpful audience that it is 2-0 instead of 3-0.
Oh,
Since
yeah.
Thank goodness for the helpful audience keeping me straight. Sorry, Nelda.
Good morning, Nelda Henning, Director of Facilities Management. I'm not going to reiterate what was just given to you, but I will be here for any questions.
Any questions?
Well, could you explain what exactly this is? Dual duct VAV boxes?
Your building has air handling units, and you have what is called a hot deck and a cold deck. So you have a boiler running at the same time you have the cooling towers are running. And the VAV boxes basically mix those two hot and cold elements to make you a comfort level. And they happen year round. My understanding is that the system has been not functioning at its optimum for a while, and it's been an ongoing concern. This project was started back last year, I believe, with investigation, and it was then determined through further investigation where the pinpoints were of issues in the VAV boxes, and there's approximately 42 that are not currently functioning correctly.
And this is, if I'm not mistaken, like the reason why one office will be really hot and the office next door will be really cold? Or?
It feeds into that, correct. Because the system is set up that you have a fan that blows, similar to what you would have at a residence. You have a fan that blows the air down a duct. And in theory, as you choke it down, less air gets to the further end of the duct, and also less heat and less cool. Mm-hmm. So the VAV boxes help control that and regulate it so that there's more consistency throughout the whole duct line.
Okay.
Thank you. Mm-hmm. I'll move for approval.
Second.
Motion for approval by Commissioner Cook, second by Commissioner Mays. All in favor say aye. All opposed? Passes 2-0. Our next item.
Item C, Parks and Recreation. Number 1, consider approval of request to advertise and fill the vacant position of park maintenance worker at an annual salary, including benefits of $41,463.74, and to fill any subsequent position that becomes vacant as a result of filling this position.
Morning, Commissioners. Jeremy Myers, Shawnee County Parks and Recreation. We have an open position with the golf maintenance team, and we're looking to fill that. We've worked with our human resources to identify the salary and make sure it's up to date, and we'll be advertising that with your approval.
Any questions for Jeremy?
No, I'll move for approval.
I'll second. Motion for approval by Commissioner Mays, second by Commissioner Cook. All in favor say aye. All opposed? Reflect that it passes 2-0. Thank you. Our next item.
Item 2, consider approval of the right-of-way settlement due upon execution for updating transmission lines over the Deer Creek Trail, East Barrow Park by Evergy Kansas Central, Inc., with compensation from Evergy in the amount of $5,968 to be deposited into the Park Recreation Building Maintenance Fund.
Good morning, Commissioners. Tim Laurent, Director, Shawnee County Parks and Recreation. Yes, with your permission, we'd like to enter into this agreement with Evergy. There are existing transmission lines overhead in that area already, and it would have very minimal impact. It's really on the edge of the park, but it is more over the trail. So I'd be happy to answer any questions.
Questions?
No, I think we talked about this a couple times before, so
Yeah.
I'll move for approval.
I'll second. Motion for approval by Commissioner Mays, second by Commissioner Cook. All in favor say aye. All opposed? Reflect that it passes 2-0.
Thank you.
Our next item.
Number 5, Administrative Communications.
This is an opportunity for any department head or member of the public to address the commission on any item.
Not all at once.
Good morning, Commissioners. I'm Sergeant Harmon with the Shawnee County Sheriff's Office. I am the hiring and recruiting sergeant. I'm promoted in December of just last year. I'm here with Lieutenant Stahlbomber, and we are here to give you some updates on our crime initiatives as well as a few statistics. And we have a short video to play for you. And then Lieutenant Stahlbomber will be able to answer any questions you may have.
The Shawnee County Sheriff's Office saw an increase in Part 1 crimes from 2018 to 2019. Sheriff Brian Hill wanted to aggressively address this increase after taking office in the spring of 2019. Sheriff Hill's proactive initiatives were implemented, and through the hard work of the men and women of the Shawnee County Sheriff's Office, arrests went up and Part 1 crimes went down. Part 1 crimes include homicide, robbery, aggravated assault, burglaries to residences, vehicles, and businesses, theft, larceny, motor vehicle theft, and arson. Part 1 crimes have been trending down since 2019. Sheriff Brian Hill is proud to announce projected totals in 2021 show a reduction of 46%. Sheriff Hill also credits a reduction in crime to the hard work of our patrol division, fugitive warrants unit, offender registration unit, and criminal investigation division. These units have been proactive with warrant roundups, registered offender sweeps, and focused patrol efforts. Other initiatives that have had an impact in lowering our crime stats include our Drug Enforcement Task Force, our drone program, proximity dispatch, and our burglary task force. Sheriff Hill's newest initiative is the SPORT team. SPORT stands for the Sheriff's Proactive Operational Response Team. Officers are selected to be part of a proactive team that utilizes multiple resources in combating crime in Shawnee County. Members work directly with our Criminal Investigation Division, our crime analyst, and our Drug Enforcement Unit. They utilize a targeted enforcement strategy focusing on high crime areas as well as trending crime data. Criminal intelligence is shared among multiple jurisdictions. Finally, we understand that we have to remain proactive in maintaining this downward trend in crime. Sheriff Hill would like to thank the citizens of Shawnee County for their critical role in helping reduce crime in our county. Your timely reporting of suspicious activity has been vitally important to this positive trend in our crime numbers.
Good morning. I'm Lieutenant Stahlbomber. I too work in the administrative division at the Shawnee County Sheriff's Office. It's always interesting hearing your own voice, but anyway, Sheriff wanted us to come over and talk a little bit more about our sport team. We're excited about that. It's been in operation for a few months now. It's comprised of about 20 members right now across different shifts, across different areas within our sheriff's office, which helps collaborate our communication sharing, our intel gathering. They've been active already. They've had several arrests in the area of human trafficking, burglaries, and narcotics. We work closely with our crime analyst in other divisions, our detectives, and our narcotics. We're just excited about it. We understand that these positive numbers that we have in the first half of 2021, we can't sit back. We have to stay proactive, and this sport team, we think, is going to help provide another resource for us to be able to stay vigilant against crime in Shawnee County. So we're happy about these numbers. Proud to be able to show them. It's the sheriff's, it's his initiatives and forethought there, and then it's the boots on the ground that are putting it into play and working hard. So we're proud of that, but we know we can't rest. So if you have any questions for us, we're happy to answer.
Lieutenant, I know that you were able to show some very positive numbers there with the Part 1 crimes going down and the initiative of sport. What are some things that we may see in the future? Are we working on some initiatives that I know that we can't talk about things that are in process right now, but what are some things the citizens may be wanting to see or be aware of?
I think that we are really looking forward in the future to working with our latest technology. The crime mapping has been essential for us, and then the collaboration with outside counties and the intel sharing and the communication sharing there. The criminals aren't just committing crimes in Shawnee County and staying. They're from Shawnee County going over to Jackson County or Osage, and there's a lot of that information that we can share back and forth in the intel gathering that I see really coming into play in the future. That's the direction I see.
Commissioner Mays?
I think it's great. I mean, it's always good to see crime statistics looking better than last year, so it's exciting. Congratulations, and keep up the good work.
Thank you.
Thank you.
Any other administrative communications this morning?
Morning, Commissioners. Dusty Nichols, Emergency Management Director. Today I'm coming to you as COVID Incident Commander. And talking with you gentlemen and other department heads and people throughout the past couple of weeks, we thought this might be a good opportunity to come up, and I asked Derek to come along as well as our subject matter expert to kind of walk through a couple of things with people to answer some general questions or frequently asked questions we're getting. But the bottom line is people are not getting vaccinated at the rate we'd like to see them. So we are, if you saw the indicator this morning, we're still in the yellow, which is, for lack of a better term right now, is good. We didn't go in the red, but we can do a lot better. I know we can. So looking at trends across the world, UK and India, we know that wearing masks and getting vaccinated makes that delta, those cases drop and other resources open for other reasons. So we really need to address people getting vaccinations. And we understand there's plenty of reasons why. They range all over the place. But if you're on the fence, don't know where to get a shot, reluctant for whatever reason, we encourage you to find good information, not just following myths you see on social media. Go to the sources. Talk to your personal doctor about it. Do all those things that you need to do to take care of yourselves. But for Shawnee County purposes, specifically, where can you find a shot, where you can get information? I'm going to have Derek come up and talk about that. So.
Thank you, Jesse.
All right, good morning, Commissioners. Derek Furlong, Shawnee County Health Department Infectious Disease Manager. I'm going to pull up the county's homepage. By the way, you may be asking, did we coordinate our vests?
I was thinking about
I will never answer that. unwilling to answer that question. No, we might have. So from the county's homepage, what people can do, so we have the different banners that people are always more than welcome to click on. Guidelines, by the way, people can find our recommendations and different isolation quarantine documents and things like that. Testing, our dashboard, and then vaccine. Anybody can click on this. This is public. And scroll down to our demographic report. So we have all of them listed since we've started releasing them. And if you click on our demographic report from the 4th, so we're still working on some data up through this week. And we'll get that out when it's prepared. But anybody can pull this up. Let me kind of zoom in for you all here. And I'm not going to go through every point of data on here, but obviously we look at the total population vaccinated in Shawnee County. We break it down by at least one dose and then completed a vaccine series. And what people should notice is that below the boxes of data is there will typically be an explanation, kind of our takeaway on what we're seeing with those data points and some definitions for what we mean as well. So a completed vaccine series, some people might see that as fully vaccinated. Those are individuals that have received both doses and they're beyond 14 days from that last dose. If it's the one dose, Johnson & Johnson, it's just 14 days after that one dose. Here in Shawnee County, we fully vaccinated almost 80,000 people, which is approximately 53% of the eligible population. Obviously, those younger than 12, 11 or younger cannot be vaccinated at this time, and there's only one vaccine that's available for those in between the ages of 12 and 17. We are still vaccinating at a rate slightly higher than the rest of the state comparatively, but we're also starting to trail the rest of the nation in some different areas. And so we kind of take all that context together to evaluate what's going on. Break it down by vaccine type. So vaccine breakthrough, I just want to let kind of you all know and the public know as well. So these are individuals that have a positive infection after they've been fully vaccinated. Again, that is individuals that have received both doses and they're 14 days beyond that last dose. The numbers on this still remaining very low. So you might see 163, even if this number was something like 200, considering that we have almost 80,000 fully vaccinated people, that number remains very low, and it's much lower than the COVID case rate at this moment in time. It's also less than what we would have expected to see. So just based off of the math around the studies of the vaccine, this breakthrough rate is lower than that as well. Symptomatic breakthroughs, we've had a few hospitalized, very low comparatively, and then you can see how much bigger the not hospitalized numbers are. So again, we would love to see no breakthroughs, but of those that are breaking through, as we call it, those people are having relatively mild symptoms, maybe no symptoms at all. Sometimes they're part of mandated testing in nursing homes, and so it's picked up that way. Otherwise, they may not know. That's also why it's important to wear our masks in settings, indoor settings like that. This is an interesting table, vaccination by month. And being honest, we've seen that grow quickly as vaccine became more available and then trail off, obviously, into these summer months. What's good to see is that the July number did outrank the June number. We saw a push late in July, really as the Delta started kind of rearing its ugly head and people started choosing to get vaccinated. And then here early in August, we've seen, this is only through the first 3 days, so almost 500 individuals. And we've got a number of vaccine clinics coming up that we're working on. We're trying to collaborate with the state as well to bring those and make those available to Shawnee County. Break it down by zip code. That is some interesting data for individuals to look at. We look at other demographic information. We break it down by age. Our 65 and older population has done a great job. They're 80% within their age subgroups. And so, I fall in this younger range, obviously, and would love to see these numbers much, much higher than they currently are.
Derek, can we stop there for
Absolutely.
just a moment? When I look at the dashboard, it looks like the 35 to 44 and the 45 to 54 are some of our highest numbers for positive COVID.
Right.
And those seem to be really they're not the highest number of vaccinated. And is that, are we seeing a correlation where our COVID rates are coming back more unvaccinated than vaccinated at this time?
Yeah, absolutely. Absolutely. And I know both of the hospitals, when they put out their metrics as well, they've talked about 80 to 90% of their hospitalized patients are unvaccinated as well. And we're seeing that as far as COVID cases go too. I mean, just looking at the breakthrough numbers, 200 or less compared to 80,000 fully vaccinated. And then within this age group, obviously makes up a bulk of the workforce. So those individuals are out and about, and some of them work in close settings. And so we try to find that out through our discussions with the positive cases, give them opportunities to be vaccinated and pass along that education. But absolutely, we're seeing more unvaccinated cases, especially in these age groups.
Thank you.
Absolutely. We also break it down by race and ethnicity as well. An important part on ethnicity is our rate of vaccinated Hispanic individuals here in Shawnee County does exceed those of non-Hispanic. And this is actually counter to what you would see throughout the state and national trends too. So again, that's publicly available for everybody. And I think, as Dusty said, just the biggest issue that we're coming across when we've talked to our long-term care facilities, because we're looking at their vaccination rates, when we talk to them about what their biggest concerns are, what are they hearing in their communities, it's typically misinformation or the myths that staff are seeing on social media or on other outlets. And so we're looking at some different educational campaigns, even partnering with a few of their associations that have real good partnerships with them. And I know as like Kansans, we always want to protect our neighbor, and I think there's no better way to do that than getting vaccinated. And I really do believe that it's a really patriotic thing to do.
So if we could just maybe kind of recap, I know a question that I get asked frequently is, where does Shawnee County stand on its total vaccination percent as of right now? And where do we stand?
Yeah, we're about 53% of our total eligible population are vaccinated. So that's that roughly 80,000 individuals. And as vaccine becomes available, that number would dip down a little bit lower. So it's about 49%, I believe, of the total population. And we would want to see that percentage much higher, 70, 80%. 100% would be wonderful. Of course, there's individuals that can't get vaccinated, but.
And as far as the health department, all persons would be considered as eligible for the vaccine, but looking at where we're seeing a highest number of positives, trying to capture that 35 to 45 age bracket, that 10-year workforce, is that kind of our key demographic that we're really trying to target now?
Yeah, that's kind of where we're shifting to at this point, I think. So obviously we have our clinic survey request form that people can fill out. So we always look at that through an equity lens, but also understanding that it may be important to partner with businesses, manufacturers, long-term care facilities, other healthcare entities that may have lower vaccination rates where people are really in these high-risk settings, and also kind of as a part of that offering education and saying what can we do to kind of combat some of these myths. Because I know people read things, but as the health department, we try to read everything. So that's a common difference.
So if we were to look at the numbers from April and May going down into June and July, it looks like the numbers are trending downward as the people are getting vaccinated. Clinics are still open and people are still able to get their vaccines?
Yes. Yep. And so probably the best thing to do, so vaccine.gov is a great tool that people can use, and they're able to input their zip code, and this would apply outside of Shawnee County obviously as well. And they can actually choose the vaccine of their choice to see where that is available at. But we have several clinics coming up. We're partnering with the Midwest Barber College this Saturday to provide a clinic on their setting. And then we have walk-ins available too at our 10th Street location, Monday through Friday. And we're doing back-to-school immunizations too. We've seen those numbers have been very busy this week as well. So again, we've had meetings with KDHE about, if we're unable to provide for a clinic, how can we send that up to you all to look at being able to provide for that too? And we're getting a system in place for that to happen as well. So really trying to make all these requests work, find out where the clinics will have the most impact in the county, and making it available, wherever we can make it available at. But all the corners of the county currently are pretty darn covered.
Okay. Commissioner Mays?
A couple things. So I think it's also important to note that the vaccine is 100% free.
Yes.
So, if somebody's worried about being uninsured or anything like that, it doesn't matter, it's still
Correct.
free. Then the other thing I wanted to point out, I didn't hear you say it, but I thought it was interesting in here, under the breakthrough cases, of those 6 cases that have been hospitalized, the median age is 80.5.
Right.
So, I mean, these are not young people that are getting hospitalized with breakthrough cases, because typically the vaccine, minimizes the symptoms.
Yeah, and if I could, Commissioner Mays, so sometimes on that point, there is some thought and some data that would suggest that elderly people have less of an immune response. Obviously, immunocompromised individuals, less of an immune response to the vaccine. So while they're still building immunity, if there's others around them that are unvaccinated, that just heightens their risk to kind of break through. So that may be why we're seeing some of those breakthroughs in older individuals as well. And that's why the vaccination is most important for that younger age group.
And then the other thing I wanted to just ask about is, I'm a parent of a kid that's not eligible for the vaccine, and he's going back to school today, first day of school. His school does not have any social distancing measures in place that we can tell. And so I'm curious, what steps is the health department taking to sort of monitor what's happening in those schools? I mean, are you guys paying extra close attention? I mean, we've got, probably 25,000 students in
Yeah.
Shawnee County and multiple different schools. Are you keeping a separate set of statistics just for school-age children?
Absolutely. So we work closely with the schools. We have weekly meetings with both their administrators and their health staff. We've done that through the summer, and we did that all through last year as well. The enforcement of like mitigation and things like that. So we give our recommendations, and we give what we know to be best practice, and that's in the health officer's recommendations too. We have the school guidance document that's online, and it was provided to them as well, just from all the different sources: CDC, Kansas Department of Education. I'm missing some big names in there, but what their best practices are to pass that down to the schools, and then obviously leaving that up to the school boards to decide what they think fits their school district best. But from our end, our support is working to making sure we can ensure testing, ensure vaccination where it's needed and where it's appropriate, where those that are eligible, and then keeping a close eye on those case counts and those quarantined kids as well. And so, one of the important things on that is that isolation and quarantine comes from the health department. It is a legal order from the health officer. And so, none of that has been changed, over the past year or so of different legislation coming down. There are different opportunities to test in the school settings. If the schools choose those routes, the state has made funding available for that. And so we're just trying to assist them through that and answering questions about testing. It can get pretty technical, as you all know. And so there's a bunch of different avenues as well, but I think our number one concern is keeping kids in school and keeping them safely in school. I also have a third grader that started today. His school is also choosing to do the same as you've said, and so have my concerns, but we'll work through it, and we'll keep a close eye on it for sure.
Thank you.
Thank you. Thank you, Derek.
Yeah, thank you.
Just one last topic I just want to touch on. I'm getting a lot of questions from event coordinators, businesses about mandates in Shawnee County. Right now, as you guys know, but for the public, there is no mandate for masks anywhere or social distance, those kinds of things. There are highly recommended actions that Dr. Locke put out, that is mask wear, social distance, those kinds of things. In particular, indoors. As we get hot like it's supposed to be today, those events move indoors, much like in the winter, they moved indoors and we saw numbers go up. Same kind of concept. If you're going to be indoors, please wear a mask. Please social distance. There's no county mandate, again. We're just trying to encourage mitigation efforts across the board as much as we can. We don't want to get to where we're overwhelmed again in our hospitals, healthcare systems, everything else, and have to revisit last year's stuff. So please get vaccinated. Please use the mitigation efforts as much as you can, and hopefully we can get everything down and kind of get back to normal as we've talked about in the past. So any questions, sir?
No.
Nope.
Thank you for your time.
Thank you. Any other administrative communications this morning? Commissioner Mays?
Nothing from me today.
Just as kids go back to school, I would ask you to please slow down in the neighborhoods, watch out for kids. There'll be walking, biking, and just please take care. And then as Dusty said, we don't want to see a repeat of last year, and so please take situational awareness. Please wear a mask if you are not in a safe environment. Take time to take care of yourself and your neighbor. Thank you. Our next item?
Item 6, executive session.
There's not a need for an executive session today. We're adjourned.
I take this.